Greetings and happy Tuesday. We are continuing our Facebook Live series celebrating National Physical Therapy Month. I am Dr. Jeanette DeWitt with DeWitt Physical Therapy and Wellness. I'm a physical therapist, an athletic trainer, and a certified personal trainer. And today we are going to talk about how physical therapy today is more than just rehab after surgery. A lot of people think that they need physical therapy after surgery, and that is absolutely true. But we do so much more than that as physical therapists. And many people also think that physical therapists just help people after replacement surgery, after ACL surgery, or they help people after they're injured. And we do all of those things with rehabilitation after surgery. We do all of those things with rehabilitation after an injury or a car accident, a sports event that has happened, stepping off of a curb and spraining your ankle. Little injuries to big injuries, physical therapists can work wonders. But again, we do so much more than that. And I'm passionate about explaining that because one of the things with my profession is we don't do a really good job of explaining what we actually do. For example, there's so many specialty areas in physical therapy. There's geriatrics and nursing homes. There's orthopedic centers. There's acute care physical therapists in the hospital. There's also sports clinics. And there's the research component, there's private practice versus hospital-based, and there's just a lot of things and areas that physical therapists can work in and help treat in regards to diagnoses, such as amputations, concussions, nerve injuries, brain injuries, spinal cord injuries, pediatrics, orthopedics, or sports injuries. And because of this, I think a lot of people don't have a clear understanding about what physical therapy does. They just think of the injury or the surgery. But physical therapists like myself often have other specialty areas that they have been certified in or that they've had extra education in. And many times these specialties or these areas of extra education are because the therapist is passionate about teaching that and helping people in those areas. And this could be personal training, fitness, weight management, nutrition. All of these are kind of wellness categories, but physical therapists are perfect at doing this and helping people transition from an injury, helping people transition from a surgery, and then improving their health along the way after they've fully recovered and rehabilitated from that injury or from that surgery. Let's look at a few things that I do in particular. And I've worked with several athletes. I'm an athletic trainer and a physical therapist, and I'm also recently become a personal trainer because I do video chats online and I can cross state lines by teaching fitness to people out of my state. And for physical therapy, I can also do video chat, but I have to be licensed in the state that the person is a resident of. So for me, I'm lucky. I'm still licensed in Ohio, which is where I'm from, and I'm licensed in Wisconsin, so I can do telehealth physical therapy in both of those states. But in all 50 states, I can do personal training and fitness, as well as some nutrition counseling. This has worked really, really well for me because I have been able to work with some runners and set up exercise routines for them, help them manage their training schedule so that they're not overdoing or overcompensating some muscle groups and kind of neglecting other muscle groups. So I've done really well with helping people, and they've done really well with the follow through, that they've stayed healthy through marathon training, they've stayed healthy through running seasons and incorporating strength training into their running program. I've also worked with people on some weight management goals. And so a lot of times in physical therapy, I talk about how if a person loses 10 pounds, it's like they've lost 30. Now, what do I mean by that? Well, for every pound somebody gains, it's actually 3 pounds of force on their joints and their spine. Therefore, if they lose 10 pounds, they're taking off 30 pounds of force from their joints and their spine. For somebody who comes to see me, and they have a lot of orthopedic issues in their hips and in their knees and in their feet, and they're overweight, I can teach them about some weight management skills, and we look at diet, we look at physical activity, and we progress them through physical therapy, and then we continue to work on the wellness side of things to help them manage their weight better and make better health choices so that they don't hurt and they're reducing the forces on their joints that are making them hurt or made them hurt and see me in the first place. In regards to nutrition, I am not a dietitian, and I'm very clear about that. If somebody has medical conditions like diabetes or hypertension or other medical conditions, then they might be better served seeking the assistance of a registered dietitian. However, if someone wants basic or general nutritional guidelines and they want to learn how to plan meals, how to make better choices, I can do those things with them so that they can look at their overall health, not just one aspect. So I do a lot of different counseling and consulting with nutrition, with weight management, with starting an exercise program, with working with athletes to make sure that they're performing at their best and peaking at the right time during the event that they're competing in. And then I also just help them put that all together and incorporate sleep and rest and relaxation moments into their schedule so that they're not overbooked and they're not overtraining or they're not getting overwhelmed with everything that they have to do and that life might be throwing at them. The other thing is I want to make sure, you have to pardon the phone call, this is live, so somebody, a patient actually calling in right now. And let me just hit decline on that and they'll go to my voicemail. Sorry about that, but we're live, so that's what happens. One of the other things is I can do a lot with preventing injuries by setting someone up so that they're developing the skills they need for their sport. For example, if someone plays baseball, I can help you throw better and pitch better by creating specific baseball exercises so that you prevent shoulder and elbow injuries. If you play soccer, lacrosse, or other field sports, I can teach you specific exercises so that you reduce your risk of an ACL tear. And if you play basketball, volleyball, or court sports, I can teach you specific exercises to decrease your risk of ACL injuries as well as shoulder overuse injuries, since those sports are really combining a lot of upper body and lower body. And sport-specific exercise programs are my specialty because I've worked with a variety of different athletes. I've worked with little leaguers, I've worked with the select and private soccer clubs, I've worked with high school Division I athletes who are looking to get scholarships to go to college, and then I've worked with Division I collegiate athletes as well when I was one of the lead physical therapists at Xavier University in Cincinnati. In addition to that, I've worked a lot with performing arts. So I've worked with some symphony musicians as well as dance, and then I worked a lot with level 9 and level 10 gymnastics. So I know a variety of sports and can really set up training programs specific to those sports so that people aren't getting hurt and that they're creating a very well-balanced strength and conditioning program that not only prevents injury but also helps improve performance. So as you can see, physical therapy is definitely not just about rehabilitation. And physical therapy is a career as a field and as a profession has really moved forward and is cutting edge with a lot of different areas that promotes the entire person and treating the entire person. It's about preventing injuries. It's about helping people perform at their best. It's about helping people recover from an injury or surgery when that does happen. Here at DeWitt Physical Therapy and Wellness, I love working with people and helping their whole being, because when you are injured, or when you're trying to meet a certain expectation, when you're trying to prevent yourself from falling, because as we age we might be at more risk for falling, and when we're trying to compete in sports or be the weekend warrior, regardless of all of these, I as a physical therapist have a lot of versatility in incorporating exercise, incorporating nutrition, and teaching people about overall wellness. If you have more questions about what I do and what our office offers, physical therapy, nutrition, personal training, athletic performance, massage therapy, any of these things, or if you just have general questions about wellness, about your health, I am happy to help you, so please don't hesitate to reach out to me. You can contact me directly at 262-842-2220, or you can email me at Jeanette@dewittptwellness.com. I look forward to chatting with you soon. Thanks a lot.